which has been organized by our Padma Shri Professor Dr. S. Natarajan. This occasion has been made in remembrance of his late Dr. N.S. Sundaram and Mrs. Kamala Sundaram, who are parents to Dr. S. Natarajan. This is the 9th endowment lecture which will be delivered by Professor Gangadhara Sundar. I would request Dr. Gangadhara Sundar to please take the dais here. He'll be the speaker for the day. I'll also request our guest of honor, Mr. Harish S. Mehta, to please come on the stage. Requesting Dr. Nitin Balakrishnan, who is also the guest of honor for the evening. I request Professor Dr. S. Natarajan to please come on the stage and throw some insight on the program which we'll be having in the next 1 hour's time. I request sir to please let us know what are the insight of this program and the importance of this lecture that we are holding for all of you. So, sir, requesting you for your insight. No, first. Okay. We are having a foundation in name of Sir's parents, Kamala Sundaram Foundation. This foundation is having an aim of helping all the poor patients. Sir is working with the aim of having blind-free India. Like any person who is having a problem in vision or any patient who is not able to afford to the high paying capacity, we have got our own foundation wherein the patient can come and get their eyesight corrected or get their surgeries done. So this is one of a very esteemed initiative that sir has been running for past many years, and I think there are thousands and thousands of people who have been benefited with all these services under the high compassionate care, I would say. There will be some insights of Kamala Sundaram Foundation that is running. I would request Dr. Uday Chandani to please come on the stage and let us know about this foundation, how it works, and what are the importance of this.
Thank you, Nita, for giving me this opportunity. Thank you so much, sir, for giving me the honor to introduce Kamala Sundaram Foundation and throw some insight into the amazing work that I have been doing. So Kamala Sundaram Foundation was initially known as the Adityajyot Foundation for Twinkling Little Lights. It was an NGO established in 2005 with the idea of eradicating blinding diseases and for providing access to quality eye care in relatively unaccessed areas. It has a board of trustees, with the managing trustee being our very own Padma Shri Professor Dr. S. Natarajan. Dr. Uday Salunke is the trustee. The other trustees are Mr. Vaidyanathan, Mrs. Sulbha, and Dr. Yong. So at the outset, we'd like to acknowledge Sir's Guru, Dr. Badrinath, who is the founder and the head of retina services at Shankar Nethralaya, Chennai, who has been very instrumental towards Sir's vision of developing a blind-free India. So coming to a short brief, Kamala Sundaram Foundation was a not-for-profit body established in 2005 out of Dr. APJ Abdul Kalam's visit to Adityajyot Eye Hospital, where he put his wish forward to put a twinkle in the eyes of those who are visually impaired. The foundation runs an outreach program in the rural and urban slums and tribal areas that strive to provide quality eye care for the underprivileged. It has had numerous projects focused on creating awareness, screening, and providing comprehensive eye care services to prevent avoidable blindness. The organization has taken special interest in promoting eye donation, and as we know, the ongoing eye donation fortnight is on. These are blessings received by Sir from Dr. Badrinath. So the vision and mission of this foundation has been to build a healthcare system enabled by the latest technologies which ensure mapping, prevalence, and timely detection, treatment of diabetic retinopathy as well as vision-threatening diabetic retinopathy amongst diabetic patients. We envision impacting more than 1 million of the population by creating awareness about diabetic retinopathy. The mission has been to screen diabetic retinopathy in the lower socioeconomic strata, screening NICO babies for retinopathy of prematurity, and to treat diabetic retinopathy and ROP using both medical and surgical treatments. So just last year, there was the 12th Medical Retina Club International Meeting, which was held in Mumbai under the aegis of the KSF in the name of Dr. Badrinath. So this is the current impact that the DR project has in India. The problem statement lies that India ranks second globally in diabetes with 17% of the affected population and about 35% of them have diabetic retinopathy. Through the vision of Blind Free India, KSF aims to identify patients with DR by free screening, followed by subsequent counseling and properly timed treatment. So in the year between 22 to 23, a total household survey of 8,177 houses was done, and more than 13,000 individuals above the age of 40 were screened, with various testing also done. So this is the story of a young 5-year-old girl with type 1 diabetes who was blind in one eye since 3 years. The other eye had partial vision, and this particular child has reached Sir's heart. And that was because when Sir, being the affectionate person he is, offered this child a couple of chocolates, the child refused to take those chocolates, saying that because she has diabetes, she cannot have those chocolates. Sir was extremely impressed by her, and she told Sir that she would like to be a doctor. And Sir has requested her parents to contact him when she is of the right age, so Sir can help out her getting into the MBBS field. So currently the KSF staff has 7 field staff, 6 females, 2 optometrists, 4 CHWs, 2 doctors and 1 camera technician. We also have high-end equipment like a Zeiss microscope, etc. The current projects include a Blind Free Maharashtra project, a BMC project in various BMC clinics along with Rotary projects, and the projects are currently supported by multiple foundations and organizations. We have touched more than 10 million lives. We've reached about 2.5 lakh slum households, and 1.5 lakh slum dwellers have been screened for diabetes. Multiple camps have been done. More than 3,000 diabetics have been evaluated for retinopathy, and our work has actually been highlighted in the American Society of Retina Specialists as well. There have been multiple projects which have been done in the BMC, for which we've required equipment for both screening of diabetes as well as screening for diabetic retinopathy. We have multiple supporters, including the Tata Trust and the Cholamandalam Foundation. So these are some images of the works that have been done in the field, where our health workers have gone out, seen patients, screened them. We have a mobile van where fundus photos have been taken and screened for diabetic retinopathy. These are multiple pictures of project activities done in the field where patients are tested for diabetes as well as screened. These are tests being done along with the BMC projects, again using an artificial intelligence-based system to detect both no diabetic retinopathy and diabetic retinopathy that needs to be referred. So these are certain images which were taken by our camera showing both normal fundus changes and eyes with diabetic retinopathy, which required the patients to be referred to the appropriate for appropriate management. So multiple BMC centers have been touched, and a lot of patients have been screened and referred accordingly to Sion Hospital, which is the closest municipal hospital from Dharavi. The Rotary camp data done in 2023 shows that 19 camps were conducted and more than 1,300 patients were screened. And we hope to take our vision forward and reach first a Blind Free Maharashtra and then hopefully a Blind Free India. Thank you so much.
Kamala Sundaram Foundation. The more I speak about Dr. Natarajan, the less will be the time we'll have in our hand. Dr. Natarajan is being a huge personality. He is very jolly in nature. He is, I would say, is God of vision. We term any complicated case that we have at our hospital. There is no saying of no to any patient. It's like he will do make that person's vision come to a normal level, which I have seen personally, and I hope many of us would not say no to this. Who knows, sir? Personally, it would be like a yes, and Dr. Natarajan can do wonders of wonder. I'm very privileged that I'm a part of that team. Sir, I would request you to please throw some insight on your experience and this endowment program, sir.
Thank you, Rita, and thank Mr. Harish Mehta, my good friend Nitin Balakrishnan, who is the president of Bombay Ophthalmology Association, and our hero today, Dr. Gangadhara Sundar. So the whole idea is coming from, oh no, this is not yes. The whole idea has come from my father and grandfather. My father was ophthalmologist. My grandfather also was ophthalmologist in 1930s, and we lived in the same, we trained in the same medical school, as well as yeah, correct. No problem. So I was trained in the eye hospital in Madras, which was called Madras at that time, which is 205 years old, and the general hospital where myself, my mentor Dr. Gangadhara, and Gangadhara Sundar, my father, all studied, is almost 800 years old, started in 1665. And then Madras Medical College started in 1834 or 35, and the school I studied in 1834. So I'm happy that we have a rich heritage. The whole idea is I use the word history as high story. I'm thankful to all the Leo Club who have come here, and I think you should know your own history of your own college. And this is the first lecture. At that time, the Home Minister, Mr. Shri Marshinde, gave the award, which was happened in Delhi, and that is Dr. John Prakash, who is the international director with his mother. And the second one was given by, that's my father, in his name, they are doing the oration. And this is given to Dr. Neil Bressler, who is the authority on age-related macular degeneration and diabetic retinopathy in the world. And you can see my best friend Shivanandan giving the scroll to Mr. Dr. Neil Bressler and his wife Susan Bressler, who's also, both of them are professors in Johns Hopkins in Baltimore. And I'm glad the previous president, Dr. Himanshu Mehta's daughter, went and worked there as a research person. And anybody from Khalsa College also who is interested in biomedical research, you can go to Johns Hopkins and anywhere in the world, because we have connection. And I'm happy to say thanks to Professor in the National Biomedical Mission, Dr. Patekta, where we are having our lab in the Khalsa College. And I think the National Biomedical Mission was started online by our Prime Minister a few years back. And this is the award given by that time the same, my parents' name. Unfortunately, both father and mother had passed away, and I took my grandmother, who lived for 102, and it's given to Dr. Marco Muro, one of the pioneers in doing artificial retina in the world. And then, Dr. Rishi Singh, he was a director in Cleveland Eye Clinic, and now also he's a director, but from Cleveland he's gone to Florida, and he's an authority in vitreoretinal surgery, and he's the founding president of Retina World Congress. So he gave, so all these lectures are for public. The idea is, that's why we have requested Indian Express to come. The reason is, we are not here to market any product or anything to do. The whole idea is, if you know you're a diabetic, and if you screen your eyes, or if you're 50 plus, you have age-related macular degeneration, if you screen, you can detect early and treat early, because we have technology, we have medicines, pharmacology to treat. And I am surrounded by research institutions. One is Khalsa College, the other is Institute of Chemical Technology, which is a deemed university. We have the best engineering college, VGTI. We are working on AI with a college called Vivekananda Engineering College. So the idea is that I love multidisciplinary approach for work, and that's why I meet a lot of, once upon a time I was a consultant in Hinduja. I used to visit the neurosurgery theater, urology, and many others. The reason is you can pick up something new to apply for the patient, so that Dr. Kalam gave me a book called Compassionate Eye Care, Compassionate Medicine by Robert Schlim and First Dalai Lama Rinpoche, where it says 200 pages on how to give compassionate care. Because when you go as a patient, when you sit in front of the doctor, either if you have a sudden loss of vision or somebody is dying in the family, and when you see like God is the doctor, but I think that's what we want to promote and make you aware. And Dr. Francisco Gandalo is from, he was the president of URetina, and he's an authority on OCT angiography in diabetic retinopathy. And now the current president of RO. RO is the largest research organization in the world. So Jyoti is here. People like her can get travel grant and travel to US. They collect the best brains of the world to do research. And we have chemists, we have physicists, we have IT guys, we have a biotechnology, bioanalytical chemistry, and whatever is your background. So I think all can work in ophthalmology. One of my friends is a PhD in chemical chemistry, in organic chemistry from Lucknow. He is now professor of one. That means he is a professor of ophthalmology in for the human and also for the animals in St. Louis. So Missouri. So here Dr. Sundar is one of the authority on working on the imaging of the eye, because we need imaging to diagnose and treat. And we can analyze in microns. 1,000 microns make 1 millimeter, but we work in sensitive of 30, 40 microns, and we analyze the layers of retina. And then recently, Dr. Rajiv Muni, originally from India, but born, brought up in Canada, he's a consultant there, and young, prolific retina surgeon working on a procedure called pneumoretinopexy. We use gas, we use oil, looks like we are like a like something like a truck driver, but as a retina specialist, we use physics, we use chemistry, we use gases, so to reattach retina so that we can rehabilitate the children. So far, we had 8 prominent eye doctors of the world giving their talk to the public. The idea is not for propaganda, the idea is to create awareness in the public. When Mr. Harish Mehta also said, what I'm going to do here, I said, I want you to be our ambassador for preventing eye problem. As an eye doctor, everybody will think we need more patients. No, I am working in the grassroots level all over India, right from slums of Mumbai, where we want to do free eye care. So our idea is not to make money. We all have made money professionally, and now we are happy to go back. So now coming, we are also contributing to the national continuing medical education. So I introduced in my grandfather's name, who was an ophthalmologist, Dr. Natarajan Pillai oration, which is done by the Vitreoretinal Society of India, and his name was Subramanian Natarajan Pillai, and he was born on 1st March 1900, and we will celebrate 125 years next year. So Joseph has to work more now. And then he did his LO in 1939, and in 1941 he migrated to Madurai because of the Second World War. And he worked from Madras, that is Kanyakumari, to Orissa in the Madras presidency. So Dr. Neil Kelly was one of the pioneers who did the first macular hole surgery. Dr. Suresh Chandra from Wisconsin, Dr. John Heckenlively, and Dr. Vinod Lakanpal is retired now. Dr. Baruch Kapurman is again the current president of Retinal World Congress. Frank Koch from Germany, Klaus Eckart from, he's another pioneer who just retiring, who did the maximum head-up surgery called. You do only 3D surgery now. You will all see 3D movie. We wear the 3D glasses, and I magnify the eye to the big screen like this, and we operate. And he was the pioneer. And Dr. Jerry Shields is an authority on eye cancer, and Carl Klass, an advanced retinal surgeon. And our own J. Krishna Ambati, originally from Vellore, Madras. He was born in Vellore. His mother tongue is Telugu, but he's the youngest medical doctor in the world. At the age of 17, he became a medical student, and he is now the chairman at the University of Virginia and doing exceptional research in age-related macular degeneration. And Dr. Alan Bird, again, he is retired from the Institute of Ophthalmology, London, and he was authority on the macula, the center of the eye, which is we are all responsible. And then Dr. Richard Spade from Vitreoretinal Consultants in New York, who spoke on OCT angiography. Neil Bressler, Philip Rosenfeld did the first antivascular endothelial growth factor injection. And the rest is Mark Kumain. He is from USC Roski. I'm closely working with him for more than 25 years. He has been, me and him introduced the first microvitreous surgery for India in 2004. That's called 25 gauge. We operate through a keyhole 0.4 millimeter, and now I'm working with him to get artificial retinal chip. Or anybody have heard of Elon Musk working on chip?
Yes.
No, I'm asking the students. Anybody know? Is his company name? Come on, they all come now. Correct. Neuralink he's made. Yes, Dr. Mark Humayun met him and told him, why don't you give funds for working on artificial retina? You know what he said? He said, no, I don't want the ophthalmologist. I don't want the neurosurgeon. He's using robots and doing robotic surgery for putting the implant in the brain. And he's thinking that when a man thinks he can open the computer, he can open the vault or anything. And he's done it as a proof of concept now. I don't know, but there are mad people who are ready to do volunteering for that, because there is a risk. You can have paralysis or you can have even a death. But the first patient is successful. 1970, one of the neurosurgeons did chip in the retina, in the brain for a blind person, but the patient died. One had a paralysis because working with brain is more sensitive. And we have Jose and Hassan Motada from Egypt, and again Dr. Srinivasa Sada. The reason I'm showing all this is we have all the galaxy of best retina specialists, and I am proud to say the most prominent work done in the world, maybe research in Europe and US, but the best surgeons of the ophthalmology are in India, and one of them is Dr. Nitin Balakrishnan, who is our guest of honor. To encourage young eye doctors, they have introduced late Nataraja Pillai Best Free Paper Award. You can see my Guru Dr. Badrinath there in the center with the students, and this happens every year in Shankaranakralaya. And I think Nitin's daughter went to Shankaranakralaya. Thank you.
Thank you so much, sir. Thank you so much for the information that you have shared. I would request all our guests to please once again come on the stage so that we can have the next session. We're any moment expecting our chief guest for the evening. In the meanwhile, I request Leo Pritam, in case if you are available here. Yeah. Pritam is president to Leo Club and Lions Club, right? Leo Club of Khalsa. He is a student there. So he will speak about. Yeah. He is giving an introduction about Mr. Harish Mehta. So I request the Leo to please take over there.
Woo!
Good morning, everyone. I'm Leo Pidambade, president of Leo Club of GN Khalsa College. So I am thrilled to introduce a legend in the Indian IT and IPO industry. Please join me in welcoming the one and only Mr. Harish Mehta. Founder and Executive Chairman of Onward Technologies Limited. Mr. Mehta journeys is a testament to his vision, dedication and leadership. As a founder member and the first elected chairman of NASCOM, he has played a crucial role in shaping the Indian IT landscape. His contributions have been recognized by none other than our Prime Minister Narendra Modi, who who honored him for his 25 years of outstanding service to NASCOM in 2017. His presence is a source of inspiration, and we honored to learn from his experiences. So let give him a warm welcome. Please put your hands together for Dr. Gangadhara. Thank you.
Thank you first of all, Dr. Natarajan, for inviting me. I frankly even don't know how to spell. Tissue engineering for liver and tissue engineering for lungs. So just imagine now these two engineers, young engineers from India, with no real other, frankly, support, had that vision and of course knowledge and expertise to go ahead and, we can say, invest 12 years of their prime time for doing research work. And that's the kind of future ahead for all of you. What today's technologies offer to you. I come from technology world, and I know that when you heard about NASCOM, it started from my office in 1988. That was a time when India was a snake Snake charmer's country, fakir's country. We were bankrupt on foreign exchange. From suddenly there to today, we have emerged as a
Can I also call Dr. Smith and Dr. Uday on the stage? Sir, आप ही पे ना दो सेकंड प्लेट दो ज्योति सेकंड प्लेट Dr. Uday for Dr. Mr. Harish. Yes. Uday. Dr. Smith. Uh, I'll request Leo Akshata to please come here and welcome our chief guest for the evening.
Hello everyone. I am Leo Akshata Hazam, the Secretary of Leo Club of GN Khalsa College. It's a profound honor to stand before you. Today is a momentous occasion. It is my privilege to welcome our chief guest, whose name evokes fond memories of our childhood, Shivaji Satyam sir, a luminary who inspired our countless hearts. Sir, your iconic portrayal of ACP Pradyuman in CID has a permanent place in our heart. Your remarkable performance in movies like Nayak, De Dhakka, and many more showcase exceptional talent and versatility. Your presence here today is a source of inspiration for all, and we are deeply grateful for your time and wisdom. Once again, sir, a warm welcome to our chief guest, Shivaji Satyam, sir. We are humbled to have you today with us. Thank you.
Thank you, Akshata. Since we have all the youngsters here, Mr. Harish sir has given us for us a take-home message for all our youngsters. I would also request Shivaji sir to please address our youngster with your experience or some two words, I would say. Yeah. Sir, please. Thank you, sir.
Hi, good evening. Namaskar. Yeah, I'm not used to this, but so getting up and asking me somewhere, asking me to speak, because I'm used to getting my lines first, learn them by heart, and then try to, bring them to life. But it's really wonderful, and I'm so thankful to Dr. Natarajan. I'm here only because of my love and respect for him. I I, I've hardly met him a few times, but whenever I've met him, I can never forget those moments when I've had a chat with him. He's always busy with some patient or the other, and I'm always there to distract him. So whatever few times that I've been there, but when he told me I couldn't refuse because nothing great is happening, there's a puja in my house, so I didn't want to leave the house. So, but then when Dr. Natarajan says, then I can never refuse that. But I really feel honored and privileged to be here amongst you all and all these gentlemen are on the stage. And very honestly, I feel really happy. Just now, I also look at the response and the love that you get from the younger generation. I said, I'm blessed. Very honestly, I thank God for all the love that I get from you people. It's the inspiration and the energy that I literally grab from you people. It keeps me going, and it's kept me going for the last so many years. I've been on the stage since 1975, 76. It's been a wonderful, fun journey, only and only because I loved what I was doing, and I still love what I would get to do. And it's always a commitment, total commitment to do what you want, and you have to be lucky to get what you like, and you get to do what you're liking it. So I think all of you are blessed that way. So keep on doing whatever you like, what you're liking to do, and be totally committed to it. And that's the best thing that you can do. Enjoy whatever you're doing. You enjoy the best, you get the best back. That's the only thing in life. And believe in the Almighty and believe in your teachers and your parents. Nothing like that, because these are the only people who give you everything out of, without any selfish motives behind it. So that's the least that I can tell you, and rest is what age-wise, yes, I can say I bless you all, but if, we are all blessed by that great, great guy who sits right up there. So I ask him also to bless you all, and I wish you all the best. And thank you very much, Dr. Natarajan, to call me here. And thank you all, and love you all, and bless you all.
Thank you, sir. I request Dr. Natarajan sir to please hand over the plaque and the oriation thing to, yeah, yeah. Yeah, it's there. ये दो ना मुझे. Sir would be reading out the scroll to be handed over for as this oriation. Yeah. First you'll read this. Yeah. No. I have. Yeah.
So it's a great privilege to present this scroll of honor on 1st September 2024 on the occasion of the 9th Professor N.S. Sundaram and Kamala Sundaram oration to Dr. Gangadhara Sundar, Senior Consultant and Head, Orbit and Oculofacial Surgery, Associate Professor, Department of Ophthalmology, National University Hospital, Yong Lu Lin School of Medicine, National University of Singapore. Dr. Ganga obtained his undergraduate and postgraduate degrees from Madras Medical College and the Regional Institute of Ophthalmology, Government Ophthalmic Hospital, Chennai, India, where myself, my guru, Dr. Badrinath, my father, grandfather, all got the same degree, and his father was a professor of dentistry and my teacher. An advanced subspecialty training from Henry Ford Hospital, Detroit, USA, where his chief, Dr. Uday Desai, visited me as a faculty and married my anesthetist daughter. And now Ganga's daughter looks after her kids, and now Ganga's daughter is getting married in March. He specializes in the disease of surgery of the eyelids, lacrimal system, orbit, and oculofacial diseases in children and in adults. Committed to clinical and surgical excellence, he is a regional and global expert in disorders such as orbitofacial trauma, ophthalmic oncology, that is the cancer of the eye, congenital and acquired eyelid disorders, lacrimal system disorders, and ophthalmic sockets. That means there is no eyeball, and some children are born like that. And thyroid eye disease, many people don't know. Thyroid problem can make the eye prominent, and also eye is going to fall down. And I was happy to see one of his patients whom he operated working in the waterfront in Singapore. And facial palsy, etc. Some of special include minimally invasive endoluminal lacrimal duct recanalization. The reason I'm reading all this may be Greek and Latin to you, but anything around the eye and the face except the nose and other things Dr. Ganga can do, including the cancer of the eye and vascular lesions of the orbit. The eyeball is inside the orbit. The Ganga is also involved in undergraduate and postgraduate education as a core faculty in residency training and a principal preceptor in ophthalmic plastic and reconstructive surgery, having trained over 24 international fellows from around the world, including India, Malaysia, Myanmar, Nepal, Philippines, Thailand, Iran, Syria, Jordan, Palestine, the United Kingdom, in addition to Singapore. And wherever he goes, and so happened Asia Pacific Ophthalmic Trauma Society, where eye injury, we have a society for all the 22 Asia Pacific countries, and I'm the president and he's the scientific chair. And we both go all over the world, not for now teaching how to repair an eye injury, but we are all here and called all the young people and the old people only to make sure if anybody should not get injured, but if at all they are injured, what should be done? And that's why this oration for the public. And thanks to Indian Express for covering this. The reason is when any injury happens, they should contact an eye doctor wherever they are. I'm happy to say any village in India will have an eye doctor nearby, maybe in few kilometers. They can go to the eye doctor, whether it's day or night. I think you should reach the doctor. And within 3 to 4 days, you should reach the tertiary care centers like adityajyot, LV Prasad, or All India Institute. Like that, there are tertiary care centers. That means where no other person can do, these hospitals can do that. So he's also running the NUH retinoblastoma. It's unfortunately, I don't know whether you have seen the movie Swash. Sir, have you seen the movie Swash? There is a child Marathi movie where a child loses both the eyes because of cancer. If you have not removed the eye, the child would have died. But now, technology Dr. Gangadhara is doing is where we can find out even during the pregnancy, either terminate if you are able to do it before, or you can do intrauterine treatment, or if it's born, then we can still treat and make the eyeball as well as eye can have the vision. So that's the advance we have. And thanks to technology and people like him. And then there is a condition which affects the, like thyroid, where you need endocrinologist, immunologist. He says, why should, when eye doctor is involved in the eye and around, why should the other specialists come? The idea is not that we are jealous of them. The idea is we know more and more of eye, which is a small part, and we know less and less of the other side. So why not we do the best? And NUH Dacryology service, that is actually the eye, there's an eye gland which secretes fluid, and it's also get absorbed by the small micro hole in the two lids, which goes through the nose and into the mouth. That's why if you've gone for any eye checkup, if you put a drop in the eye, it'll be, you're having a bad taste in the mouth. So that's because of the connection is good and it's required. Otherwise, water keeps coming and people will have irritation while talking or watching TV. He's an active member of numerous international professional societies. Dr. Ganga has won many awards for his work, including the Best Teacher Award from National University of Singapore, Achievement and Senior Achievement Award from the Asia Pacific Academy of Ophthalmology, American Academy of Ophthalmology, Ophthalmic Trauma Excellence Award, in addition to delivering numerous society and lay lectures and orations internationally. I think a big hand to him. I am very glad he's from our part of that is what do you call the place we were born, from Madras, now Chennai, and he's a great teacher world over. And some of these include inaugural Brucia lecture at the North American Society of Academic Orbital Surgeon, and is the only invited member from the Southeast Asia to the prestigious Orbit Society. The reason we are proud, and not just because he's from Madras or India, he's actually, we are the best eye surgeons of the world, and we are happy Dr. Ganga is sitting in Singapore. He worked in US, he worked in Shankaranatralaya, but now he says any patient who's coming, because the Indians have an attitude that every day, a lot of my patients go to New York, London, or Johns Hopkins, or even Harvard, and then they will say, why the hell you come here when you have Dr. Natarajan in Bombay? But they realize only after going there. What's the use of wasting money, time? But wherever we do the best. Dr. Ganga travels widely as a regional and international faculty at various orbital and craniomaxillary facial conferences, raising the level of care of orbital and orbitofacial disorders, and has contributed chapters to several textbooks in his field. He has and continues to serve in leadership capacities in various national, regional, and international professional societies, including the prestigious Asia Pacific Ophthalmic Trauma Society. In addition, he has given the name from ocular. Ocular means only eyeball, and ophthalmic means eye and all the around structures at Nexa. In addition to several scientific peer-reviewed publications, he has authored 3 books, including Orbital Fractures, Principles, Concepts, and Management, and co-authored a book on ocular adnexal lesions. And thank you very much, Ganga, for coming, and happy to give you the
Sir, we'll request you to please give this shawl to Gangadharan sir. You, sir. So you have to do. Yeah. You have to. Nitin Balakrishnan. Yeah. Requesting Shivaji sir to please hand over this plaque moment to Gangadhar sir. And the medal to be given by sir. Yeah. Dr. Nitin Balakrishnan. Please hand over this to Gangadhar sir. Can I request Dr. Smith to please come on the stage? Yeah, Requesting Smith sir to please honor Shivaji sir with a shawl and a plaque. Dr. Smith to honor Dr. Nitin Balkrishnan. Dr. Uday. Dr. Uday to honor Mr. Harish. Yeah. Thank you. I'll also make a point to mention a special thing about Shivaji sir is he has been awarded with the V. Shantaram Jeevan Gaurav Puraskar. So please give a standing ovation and a round applause round non-stop for him. The clap should go on. अरे आवाज ही नहीं आ रही है तुम्हारे क्लैप्स की और जोर से thank you so much.
So I invite Dr. Gangadhar to give the talk. In the meantime, we can sit down and see the screen. We can go down, sir. Come, Harish. Nitin, you have to give the summary after he gives the talk. You have to give the summary as a guest of honor.
That means you're forced to listen to the talk. No doubt about it. It's a pleasure.
Yeah, okay. This one, huh?
Yes.
Yes. Okay. Full screen. And can we have this lights off? This one? This lights off? Okay, thank you.
A warm good evening, everybody. It's truly a great honor to be invited to this great city of Mumbai. I got a real taste of it in the past couple of days, dealing with the traffic, the wonderful blessings I was getting every 10 meters as we were driving by. But over the past couple of days, including nights, and we were out at 2 in the morning yesterday, I was telling Mr. Mehta that 2 in the morning there was a pharmacy open to dispense paracetamol tablets, which you will not see in any other city in the world. And I was telling the president of the place where Dr. Natarajan is staying that I'm now thinking about moving back to India and possibly Mumbai and possibly Parel. Truly is a great honor to be receiving this award on behalf of Professor N.S. Sundaram, Kamala Sundaram, bequeathed to me by Professor Natarajan. But what is even greater is to receive it amidst some great celebrities, people who have transformed the country one way or the other. And I think Mr. Shivaji Satam, who's been in the industry since 1970s, and was probably a little boy playing marbles. I apologize for not having watched any of your serials, but I know I'm going to go back and look into it. But tells you how that industry can touch individual lives in their living room when the world is going around with all these wars and chaos going around. So thank you very much, sir, for continuing to be an inspiration and more importantly, being as active, energetic with a smile on his face. The second great person is Mr. Harish Mehta. I didn't know much about him because we don't live in the tech world and we are doctors. We cannot think otherwise. We only think with our blades, sutures, and needles. But having listened to a great talk on the technology revolution India has gone through, I was in Coimbatore when the great oration was given, it has literally leapfrogged India from snake charmer's country. And when I was interviewed for a residency in the United States, the first interview question was, are there elephants and cows and dogs on the road? And took it as an offense when they say, no, I come from a city of Chennai and all these wonderful metropolitan city. But that's how much transformation has occurred because of bringing minds together. You know, Indian minds are not easy to bring together. And those of you who are voting in elections, you probably know this time after time after time, to bring it all together. So truly it's a great honor, sir, for having done what you have done for the country and to give a talk on this topic. I've titled this talk as Chandrayaan, Mangalyaan, and Drishtiyaan. And those of you who are probably aware of even reading the newspapers and watching television know what this is all about and why is an eye doctor talking about these topics. A tribute to the great Dr. N.S. Sundaram. I have seen him. He has been my teacher. He was a good friend of my father's, and most importantly was one of the first ever to write a book on ophthalmology in Tamil, the mother tongue of Tamil Nadu, and won a state award for that. Is that correct? So this is the kind of pioneering work not Dr. Natarajan, but Natarajan's father has done, and nothing happens without the woman in the house. So, and the woman created Dr. Natarajan. So let's give them a big applause. And you cannot talk about Dr. Natarajan without mentioning about the great Achi. Those of you who've been with him kind of know that how fondly he was taking of his grandmother. At 100 years of age, she underwent a hip surgery and a general anesthesia. But at 80 years, people are saying, I'm too old for having anything done. So you can make out that Dr. Natarajan now in his teen years, going through his puberty, I suppose. So a lot more that is going to be, and these are the people who have created him. And these are the past orators. You've heard a little bit about him, but these are literally celebrities in ophthalmology from around the world, so a little respect for them as well. Dr. Natarajan hails from a family of ophthalmologists. He is only the third generation ophthalmologist. The black and white photograph on the top is where he had served as an ophthalmologist way back then, subsequently his father. And literally he grew up in the same institution where his father and a lot of legends of ophthalmology grew up. Dr. G. N. Rao, for example, from Hyderabad, L.B. Prasad, Dr. Venkataswamy, for example, all trained in the same ophthalmic institution in Chennai. And he literally grew with all these people around him as a little boy, playing, and I don't know whether he had any eye injury at that point of time. But I'm sure he was a naughty boy then, if you can see how energetic he is at this point of time. But the girls know him as the Markandeya, somebody who never ages. And I've had the privilege of interacting and working with him, and the two commonalities that I have is we also graduated from the same medical college and also the Regional Institute of Ophthalmology. Just a government ophthalmic institution, but the second oldest eye hospital in the world. And I continue to be inspired by what Professor Natarajan continues to do around the world. I'd like to pay respects to the guests of honor who have been here over here, the award winners over here, people who have transformed the country, Mr. Shivanandam, who's a good friend. I met him a few times, and also speak to him on a regular basis, and honored by the President, Dr. Nitin Balakrishnan, who's been here. Before I go any further, there's going to be some graphic pictures I'm going to be showing over here. So those of you who are traumatized, this is not just a television warning, but there's a real warning of some gory pictures. And there's an intention why I'm going to show you the gory pictures, because we have 80% of the population, the youngsters, who all think that accidents happen to the guy next door, never to me. And the reality, we are meeting children almost every day and every week who are injured. And unless it happens to you personally or your family, you don't really feel the deep impact. So I'm going to show that. And for the same reason, please don't take any photographs, because I have permission for teaching purposes for these patients. So ophthalmology is a disease of the eye. We all know about 90% of what we know about the world is from what we see with our eyes open. Ever since we are born and as we learn, as we go along. It is only the person who is congenitally blind at birth, who learns about the world through other senses itself. And we are all familiar with the standard diseases, cataract, glaucoma, diabetic retinopathy. And these are simulations of various visual distortions that happen, that if you have these blotchy images, floaters in the eye, can't really see the center of the eye, that's what happens. So those are the common disorders that you normally talk about and see when you go to an ophthalmologist's office. But the bottom line, the most important thing I put over here is the part where others or miscellaneous comes in. And that's what I'm going to talk about today. And I call these as the two orphans of eye diseases. One is cancer of the eye. People don't even know that you can get cancers in the eye. And if you don't treat that cancer, like Professor Natarajan was saying, children die. And India having a high birth rate, this occurs 1 in every 14,000 children. It doesn't matter whether you're a male or a female, you're a North Indian, South Indian, you eat vegetarian, non-vegetarian food. 1 in 14,000 of these children is going to get a cancer in either one eye or both eyes. If you don't remove it in time, 6 months to 2 years, these children are dead. And it's not just the life alone. When removing an eye, and you and I did not have an eye, or you and I even have a blotch or a scar on the face, how much of a stigma that we have. These children go about in society. So eye cancers. And the other often we're going to talk, which is the point of the talk today, is about eye injuries itself. So these are examples of pictures of children with cancers in the eye. And you can see these children, cancers happen not only in children but in adults as well. And that scan on the right, you can see over here is where I work in a multi-specialty hospital. If you don't treat the cancer in the eye in the adult, it soon goes to the liver. And these patients, again, are dead and gone in about 6 months' time. So do not treat any eye diseases trivially. And Dr. Natarajan said, make sure you do go for a good ophthalmic consultation. And these are other cancers that happen on the eyelid. You see the picture on the top is just a small blemish, a pigmented mole-like lesion on the top. But if you neglect that and choose not to do anything, that's how much it eats into your entire face and can go into the brain and kill you as well. So, and of course, there are tumors in the eye sockets as well. But eye injury is the other orphan. And it happens every single day in some household or the other. And we classify them, if the impact is good enough, but the eyeball is still intact, we call them as closed globe injuries. These are patients who have pain, redness, inflammation, even bleeding in the eye. And sometimes you don't notice it until you look at the eye with a microscope. That's where when you have an injury, don't wait 10, 15, 20 days if you're having problems. Go see an eye doctor immediately. Happens to sportsmen all the time. Or if the impact is severe enough, it's an open globe injury where the eyeball ruptures like a tire flat. And you don't repair these globes in the magic period of time, you can risk guaranteed this patient's going to be blind in that eye for the rest of their life. And of course, the rare situations of globe avulsion. The picture at bottom right is a Kannappa Nayanar, who's a devotee of Lord Shiva. When Lord Shiva is supposed to be testing his piety, he said, what will you give me? He said, I'll give you an eye. And Lord Shiva takes one eye, scoops it out and gives it to him. And the Lord Shiva then says, now give me the other eye. As a test of piety, he puts a toe on Lord Shiva's eyes because he doesn't know where Shiva's eye is going to be, if he's going to give him his eye, and almost goes on to about to scoop the second eye. So this is there in the religious scripture. But this happens in violent accidents as well. We even have psychiatric patients who gouge out their own eyes. And as you see in the Kung Fu movies, these people do it as well. So these are the kind of injuries that we see itself. And Dr. Natarajan talked about not ocular trauma. This is for ophthalmologists in the field where we talk about globe injuries. But remember, the eyeball is protected by the eyelids, the eyelashes, the tear film on the front of the eye, and is housed in a beautiful socket of the orbit. That's where the term ophthalmic trauma comes in. This is a patient who had a blast injury, and you can see not only is the eyeball injured, and you can't even see where the eyeball is, the entire midface is gone, and even the bone is shattered. So no point just fixing the eye alone if you're going to ignore the rest of the face as well. And that's where the concept of ophthalmic trauma comes in. So the structure that kind of protects the eye, blinks and all tears and so on and so forth are the eyelids. You can have various forms of injuries. So these are very common in children, people playing with pens, pencils, knives. I even have children who play with a remote control car. There's an antenna. And the antenna waves enough, that's enough to cut the eye. Or mothers who are feeding their babies with the jacket with the hook on the eyelid. It's very common in India to see the mother holds the child, eyelid gets stuck in the hook, and the mother takes the baby away. There's an avulsion of the eyelid as well. These are kind of things that happen, and if you do a bad job of it, those are the bad scars that can happen. So it's no longer just eye injury, but we're talking about eyelid injuries. This is a gentleman, young man. The usual story is I was minding my own business in a bar. Some random guy and beat me up, and that's never true, right? Never believe these guys sitting in a bar giving these random stories. So he was assaulted with a beer bottle, and he came to me 5 days later from Vietnam because everybody said, your eyeball is gone, you have to take the eye out. He contacted an ophthalmologist in New York. Dr. Natarajan, your story again. New York ophthalmologist gives me a call and said, why come all the way to New York when I can go to Singapore? And shows up 5 days later, and we still managed to save that eye. Yes, the eye didn't see at that point of time, but at least kept his eye. If only it had come in the first 24, 48 hours, we could have even given his vision back. This is the same blast injury where we go beyond the eyeball itself, and despite the fact he's completely lost his eye and broken his face, when you fix him, you can still give him his original face back, minus his original eye. What he's wearing there is a fake eye, a prosthetic eye as well. So even if they're going to be blinded, theoretically you can restore him back to normal so he can go back to his work life social life, and so on and so forth. So eye injuries, bottom line, are not just blinding alone. They are disabling, because if you lose your vision, there are certain jobs you cannot do if you're one-eyed, for example, and you're unfortunate enough to have lost both eyes. You can imagine your career prospects yourself. Yes, you can make do and come up with other job prospects as well. And it's disfiguring, because psychologically, the way you look at your mirror is we comb our hair, we put our tie, adjust our tie, and so on and so forth, is how you project yourself in the world. So eye injuries, bottom line, are blinding, disabling, and disfiguring. And that's what we're going to talk about, and which is a population which is typically involved. I don't know if you have a mouse over here. You see the chart over here. The vast majority of them are youngsters. These are the people on the roads. These are people playing cricket and tennis and sports and so on. And a lot of them are young children. And why is that? It's just blindness. So what? The other eye is there. Can you still see? But if you look at the chart to the right over here, the more blind you are, it even reduces your life expectancy. It's been shown that if you lose both your eyes, for example, there's a 3 times higher risk you're going to die prematurely, because you cannot navigate, you cannot go to regular checkups, other health disorders, and you can trip and fall and injure other parts of the face as well. So blindness is not just an eye and a visual phenomenon, it's potentially impacting your life in more ways as well. Of the 8 billion, India has reached a landmark of being one of the most populated nations in the world. Yes, we got to be proud about it. I think that's the reason why I titled this talk as "We are ahead and behind at the same time." In a lot of things we are far ahead, but in a lot of things we are behind. And this 1.1 billion population of the world, a good proportion of them, 90% of them, are blindness, is either curable or treatable. And we have ophthalmologists and voluntary welfare organizations who are doing a huge campaign about trying to reduce blindness in our part of the world. And this is where we are behind. If you look at the impact of blindness, the vast majority of population is in South Asia, India, Pakistan, Sri Lanka, Nepal, Bangladesh, Myanmar, and so forth, and China. And yes, again, we are ahead, sadly to say, in terms of blindness rates compared to even China, which used to be the most populous nation in the world. And that's where there's a lot of hope when I see youngsters in the crowd looking for somebody to give you a job. You beautifully said, don't be job seekers, be job creators and job providers. Don't look for somebody else to give you the job. You create the job, because along with the strength of population, we have huge opportunities. And as you know very well, our leaders are the ones who are performing around the world and changing the world for the better. So there's a lot more work to be done. When youngsters are saying there's no work, unemployment is high, a lot more work to be done. And amongst the causes of blindness, that's where injury and trauma comes in. The logo is the logo of the Asia Pacific Ophthalmic Trauma Society. Professor Natarajan is the president of the society. And that picture, the graphic over there, is a graphic representation of the eyeball. But you see those sparks in the center? We designed it because these were fireworks which are going into the eye and blinding our patients. So what is a culturally rich thing that we're talking about? I see firecrackers on the streets even today, is also a leading cause of blindness. And typically these are young adults and children. And that's what we're going to be talking about today. So the burden of blindness is very, very high. Even if one person in your family is blind, there has to be a caretaker to take them, who in turn cannot be doing their job. There's a loss of income. And because of that, they stay back and take care of these patients. That becomes very difficult. In addition to the cataract problem, the diabetic problem, and the age-related macular degeneration, that's where the others comes in. So when you look at blindness in general, there are still certain diseases we have not found a cure for. You mentioned about tissue regeneration and so on and so forth, stem cell research, artificial retina. We're still far, far away. We still have diseases where we're incurable. But what we're going to be talking about is the avoidable blindness. And the avoidable blindness have 2 components. One is a curable blindness. And I think India has done a superb job of going into the rural areas, identifying people with blinding cataracts, and doing it even for free. I go around the world and saying this in other parts of the world. India is probably the only country in the world where even in a private ophthalmic institution, I would dare say 20 to 30% of patients are still having surgery done for free. Am I correct, Dr. Nitin? There's not a single private ophthalmologist who's not done a charitable cataract surgery. This does not happen anywhere else in the world. So I think you people should actually take the credit for being born in a country where selflessness of healthcare workers is always paramount. Yes, we do ask what insurance you have, what credit card you have. But even when a patient says, I don't have money, These patients are never turned away. Am I correct? Yes. So that's where I think the recognition has to come for most disorders, I would say, but ophthalmology in particular, charitable wings are very, very high. And the bottom line is the preventable blindness. And that's where we are not doing enough. We are still behind. Playing sports. So when I talk about preventable, yes, we wish it was 100% preventable, but unfortunately not. Kids are going, playing, youngsters are going. Today we're talking about the jogging track and a running track at the Ashok campus where people trip and fall on a rainy day and so forth. So I would dare say if not 100%, at least 90% of this trauma can be preventable. I'm going to talk a little bit about it. This typically happens in children. We have our native games that kids play, and during the COVID times and everybody was at home, not going to work, children out there playing the gilli danda and throwing things around. There was a lot of injury that were reported in children as well. This is a child running around in a shopping mall and these hooks on which various objects are hanging. He's running hide and seek with his brother, jumps and gets his eyelid stuck in one of the hooks. And that's a picture that he have. Thankfully, his eyeball is intact and this kind of accidental injuries happen. That's why we say 90% of this trauma is preventable. But the adult working population of the workplaces where regulation is not intense, and of course, elderly people who fall, who get injured in the eye as well. Another situation where India, I think, is unfortunately way ahead is road traffic accidents. India has the highest road traffic accidents in the world. Different medical professions, orthopedic industries, neurosurgery industry, now ophthalmology is trying to raise a PIL to raise this awareness amongst the government because three factors play in all these accidents. One is the individual itself, whether he or she is driving the vehicle. One is the vehicle itself. That's where the speeding and the brake and all this comes in. The third is infrastructure, bad roads and stuff and so on as well. And that's where I think there has to be a partnership between regulators and country, which is collecting the taxes to deliver the optimal environment in which people should work. And likewise, responsibility of us citizens in following rules and laws and helmets and so on and so forth. And this occurs, and those of them who don't die are the ones who are going to have residual morbidity, broken bones and the eyes and so on and so forth. And those are the patients we're talking about. Another sad thing that we hear about India is the bystander effect. Every time there's an accident, there's a dead body on the road or somebody badly mutilated, 90% of the people are just looking around, taking a video of it, streaming it live. Poor fellow, he got injured, not realizing it could be his own brother or father or son or whoever it may be. They think accidents is something that happens to somebody else, not realizing next day it could be themselves as well. So I want the youngsters to be aware of the fact that these are the things that where you guys should become a campaign and start spreading that around and be the first volunteer. There's something called a Good Samaritan law where people are scared of touching these patients. They thought the police is to come and investigate and they're going to interrogate me and so on and so forth. Be the Good Samaritan. Even going to be in the firing line and investigated by the police. Step up and see what are the various things you should be doing for these patients as well. So apart from road traffic accidents, one of the major things, again, Ganesh festival is going on, Diwali comes on year after year, are firework injuries. Poor regulation of this industry, and I have my own fellow ophthalmologists who keep saying, but this is part of our culture, this is part of our religion. Children should play with fireworks, and I have children, and I am guilty as a child also having held some of these in my hands as well. Community lighting of fireworks rather than individual playing with heavy intense fireworks and keeping the fireworks to the children with the simple safe devices and leaving the high complex ones to the community environment is I think is very important. I think Dr. Natarajan is trying to lead this PIL towards regulating fireworks and we are getting a lot of pushback. We've met with the ministerial level, at the central government level and so on and so forth. I think we have our medical writer over here. Again, this becomes a very sensitive topic because then they say, what about the livelihood of the people who are making these fireworks? That's where the tech industry has to showcase the examples and saying that, yeah, that alone should not be justification why we should be blinding and killing a lot of people. We need to find alternative jobs so that these people can find other careers, with the talent they have, minimizing the common public utilization of high intensity fireworks which can cause blindness as well. So I think that's something very important. This is where regulation comes in. And even though laws are available, enforcement is not there. And that's why we need buy-in from the public as well. They say, it's my festival, I want to light fireworks, not realizing the child next door is going to go blind from an accident that's going to happen. We periodically hear about explosions that happen in this firework industry because economically there's a money-generating field, not realizing people are dying as well. So who are the common victims of blinding injuries? These are adults. These are working adults who are contributing to the economy, not just to themselves or their family, but to their society, their city, their state, and the country. So in fact, every single time somebody has an accident, the country suffers. We don't realize that. We think, poor fellow, that's neighbor, he's suffering, his family is starving. You don't realize our country is being deprived of economic growth only because of the negative effect that we see as well. Next to the working adults is the teen and the young adults. That's where contact sports and violence also comes in. And unfortunately, I don't want to touch on that very sensitive topic. Children, that picture that you see on the top is a child going to school wearing glasses. A Grab delivery driver or the delivery guy on a motorcycle comes, hits the glasses, the spectacles break, and the lens cuts the eyeball. That's a real story. That's, in fact, a Singapore story. Everybody is doing right, but the Grab driver is going on the pedestrian path and the child is going with the mother, and you have a blind injury. That's why I said 90% of it is preventable, not 100% as well. We'll later on find out what happened to the child later on. And that child had the eyeball cut, eyelid cut, the orbital bone was broken, and we had to fix it all during COVID times when there was restrictions on surgeries that we could do. Anesthetists were not willing to give anesthesia. Elderly, and practically everybody is a potential victim of eye injuries. Risk factors are things that happen in the workplaces. Violence is quite rampant in the name of either religion or state or language or whatever it may be. Road traffic accidents, we talked a little bit about it. Sports and games, and I think now there are leaders now who are promoting sports in India big time and South Asian countries. These are where, again, protective eyewear, we had a chat this morning about enforcing eye protection before the injury happens, not after the injury happens, and of course domestic assaults. So that's what really differentiates a developed and a developing nation. In a developed nation, the rules, law, regulation, education, and there's somebody who's watching, and if you violate, you're going to be penalized. Here, it all exists and everybody knows everything, never enforced, not by the parent, and so on and so forth, and there's no penalization as well. So what is the deadly combination for bad injuries? Age, unfortunately. What is your strength? Is your weakness as well? Youngsters, males, they're very risk prone. So girls, keep a watch on these boys. You be teaching them a lesson. And alcohol. This combination is a deadly combination for road traffic accidents, injuries, and so on and so forth. And there are numerous mechanisms that happen. We talked a little bit about it, but even simple things, pens and pencils, are enough to cause various forms of injuries as well. Remember, not all injuries are mechanical. Again, another place where South Asia is the leading part where injuries happen is chemical injuries. We have educated people. I have even stories of doctors throwing chemicals on young women just because they said no. So the greatest victims are young girls and women as well. And this is where I think we have to bring up a generation of people where there's equal respect, and so lovely to see so many young people admix with each other, so there's mutual respect for each generation. And thankfully, the Bollywood industry has done their part in bringing it to the attention of the various people as well. So globe injuries, number one, when an injury happens, or even if you don't know whether you've been injured or not, whether damage has been done or not, go for an eye checkup, okay? If the eyeball is broken, don't go shopping between doctor and doctor. If doctor recommends surgery, just do it. Who says that? Nike, right? Just do it. Don't go for second opinion, third opinion, go for delays. Get it repaired first, then you can go for a second, third opinion. And once a primary repair is done, if it's a complex injury, that's where centers of excellence comes. Jyot, for example, Shankar Netralia, for example, LV Prasad, for example. That's where the complex work can be done. And the job is not done once the surgery is done. There still is a rehabilitation process. That's where the follow-up that the doctors recommend, medication, seeing amblyopia, laser therapy, lazy eye therapy is very important. So the picture left is the same as the picture right. After the repair was done, 2 in the morning, we repaired the globe. Same time, we fixed the eyelid laceration as well, rehabilitated. Child developed a cataract. Cataract was removed. Retinal detachment was done. This child now has 6/6 vision in that eye, same eye, and going to school like a normal child. So the take-home message is that most of these globes can be repaired. But you have to seek attention at the right time with the right person. We'll talk about all those things in a moment. And it's not just the eyelid. These are patients. One is an ATM robbery, believe it or not, happened in that part of where I live in. Motorcycle accidents. Looks kind of hopeless. Do a good job, you can do a good job. And I showcased this in the CME yesterday. This is a newborn baby out in the park where a monkey snatched a baby. And you can see the deep cut. Thankfully, the eyeball was spared. We fixed it all in one surgery. 1-month-old baby under general anesthesia. You can see the outcome that happens. The child has never had any other surgery since then. So primary repair, yes, we doctors can do when the child or adult comes early. Likewise, if you have busted face and the orbit, we can do heroic surgeries. You can see the busted skull over there, eyeball shattered. We can put all this back together, anatomically reconstruct, and we are able to use a good combination of not just surgical techniques, but technology. And that's where IT comes in, artificial intelligence comes in. We use a lot of IT technology to mirror the normal side to the abnormal side so that we are able to replicate what we have on the right side over here to the left side. It gives us a quality control. We have done a good enough job and restore them to the pre-morbid anatomy itself. So, and we use a whole bunch of implants and devices and technology similar to the GPS navigation that we use for orbital reconstruction. That's where we guys come in. We are oculoplastic surgeon or oculofacial surgeons. We are ophthalmologists who work with the plastic surgeons. We learn little tricks from them. We learn with the ENT surgeon. We learn tricks from them. We work with the neurosurgeon, learn tricks from them, neurologists, and so on and so forth. So we are half, I don't know if you know about the sedans and the SUVs. And nowadays we have crossovers, right? We are ophthalmologists who are kind of crossovers. Half ophthalmologists, half plastic, half dermatology, and so on and so forth. That's what we do for a living. And these are the common conditions that deal with eyelid disorders, droopy eyelid disorders, cancers and tumors, infections of the tear ducts, thyroid eye disease, that's a classic example you see on the top right, and tumors behind the eye, in the eye socket remove. And the bottom right is a child with retinoblastoma, eye cancer in the eye, which you don't treat. That's what we oculoplastic surgeons do. So these are examples of good injuries, bad injuries with good outcomes. Yes, certain things can be 100% redeemed. This is the bottom right is a retinal detachment. Dr. Natarajan is a world-renowned authority where he does this for the second time, third time when somebody else has tried to fix it. And like, I think Neeta was there, she was saying that, right? Patients come with just hope and nothing more than that. And he gives them sight. At least he gives it a shot, which others would have really given up as well. These are examples of patients. Again, this guy was installing a glass pane, a heavy door, which fell back on him. And you can see the entire gash that comes along the entire face. And you can see the scan. It even cut into the brain and the socket up above. Where a simple procedure, the same patient in the top right, we're able to repair him and reconstruct him, and broken faces as well. That's why we oculoplastic oculofacial surgeons do. That's his pre-op and that's his post-op. Okay, all with one surgery. So do we ever give up? Again, textbooks talk about when it's very badly mangled tissue, very young children who can't cooperate, very old people, no point, the patient's already 80, don't bother putting them through surgery or poor visual potential. Those are patients, sometimes even our own teachers say, don't do much. But that's not where we come up. We never give up. So there's a doctor who's trying to say, even if there's a 1% hope, try to get the fixed part. My cousin used to say in Ganga Hospital, say, to a man who has nothing, even a little bit is a lot. So if somebody just has 1%, 5% chance of recovery, give him that 1 to 5%. Because if he gets it, it's 100% for him. For you, it's a 1%. For him, it's 100%. So message is, don't ever give up. Even if you can't be the great surgeon, Dr. Nitin or Dr. Natarajan is, do the best job possible and immediately refer to somebody over there as well. So I'll kind of finish off in the next 5 minutes or so. So then people also say that, don't worry, my cousin had it done, Dr. Natarajan, so no matter how bad the eye is, he can fix it for you. Why worry? do the risk behavior, so on and so forth. We all know the IT industry term, right? GIGO, garbage in, garbage out. You come up with bad tissue. You can go to the best tailor under the sun. If your fabric is not right, your suit is only going to look so good, right? So you do not want to have bad tissue. So that's where prevention really comes in. So in reality strikes, this is a famous quote by Black Jewels who says, and I'll read it. You awake from sleep hoping it is all just a bad dream, a bad injury. As you open your eyes, reality is staring you in the face, like a growing tiger, and strikes your heart as it implodes within himself, which means that we can do the best job possible. Still, outcomes may not be as great, and we have very disappointed patients. So the standard attitude of our public is, when things go well, they go thank God, buy a coconut, spend $1,000, go to this temple, that temple, go on, whatever it is. When things go wrong, blame it on the doctor. And I think India again is known, again famous for violence against healthcare workers. I think that's a protest from Maharashtra, if I remember right. You did that campaign as well, where every single time, and we now know what's going on in the other part of the country as well, violence against healthcare workers is zero tolerance in other countries. This is one of the very few countries people still get away with it. And that's where we need support from the various professions to rally against all this violence against people who are putting their neck in the line to save your eyes and save your lives. So how about people where you cannot do much anymore, or even had their eye removed like this patient over here, or had both eyes damaged like in that situation? Even those patients, they can restore them so that they can go back and function, have a social relationship, get married, have children, keep in a job, apply for interviews, so that self-esteem is good, and which is what reflects in their productivity. So going back to the last part, what are the things we can do? Trauma, number one, education. That's where this oration kind of comes from, about prevention. Prevention, prevention, prevention. It's still better than any cure any best surgeon can do. If it happens, first aid, protect the eye from additional injuries itself, put a shield on the eye, don't put a patch on the eye. And if there's a chemical falling to the eye, wash it copiously, even with tap water, that's what you have. Education has to happen in schools, in universities, in workplaces. Refresher courses have to happen. People have to be reminded time and time again. That's where the drill that we all do in various industries is very, very important. Primary care center, they can't do the best job possible. They do damage control, do the immediate primary repair, and then refer to the secondary or tertiary care centers. So how much can doctors do? Yes, a lot we can do as well. This is where the private-public partnership comes in. Patient, when has an injury, just goes to the clinic next door. They don't care if it's a private or public place. So these private practitioners should not turn these patients away. They should do the primary care necessary. Yes, legal issues are there, but I think that's where the law has to protect people who are doing this. And that's where the government institution comes in, because they do a lot of training, and that's where colleges here are groomed. And I see institutions in India. I went to Nair the other day. My father trained in Nair Dental College, for example. And these surgeons are all over the world doing such a great job. This is where, again, the private practitioners have to support the government institutions, as should the government as well, so that we have centers of excellence. So adityajyot is example, Shankar Netralia, for example, LV Prasad and Arvind Care System as well. But the public also has a role to play. And that's where prevention from these kind of talks and what you see on YouTube and so on and so forth is very important. They have an obligation, if you're running an institution, college or school, or whatever it is, to provide a safe educational working environment, adopt and enforce safe practices. You're in a chemical lab doing chemical experiments, they ask you to wear goggles. Please wear goggles. There's a reason why it's given. It's cool for guys to say, I don't wear goggles, I'll take risk all the time, just to show off. That's not right. Wear and show, be the good example as well. Learn emergency first aid therapy. Our school kids in Singapore are taught basic cardiac-like support. Kids can now resuscitate an acute cardiac arrest on the street. They're certified. So that's why you youngsters should go for primary training by institutions as well. The partnership comes in as well. Seek immediate professional medical treatment. And the doctors also, go to doctors who are well-trained and well-qualified. Don't go to quacks who do all kinds of mumbo-jumbo therapy as well. And this is where societies comes in. You can assess the competence of the doctor based on the kind of societies their membership were, whether it's a state society or national society or international society. Because the more they attend these meetings in the various societies, their standard also goes up. So that's where when patients are shopping around, going and to certified doctors who are members of various societies, very important. So most injuries happen because they were not wearing the eye protection when it's supposed to, and we'll talk about who should be wearing eye protection. And even when they're wearing eye protection, injuries happen because they're wearing the wrong type of protection. That's where the quality control in the various hospitals is very important. An important message for youngsters and children, spectacles break. That's because a shatterproof glasses should be made of polycarbonate. Again, in developed nations, all children by default get polycarbonate spectacle lenses. Sad to say in India, I don't know Dr. Natarajan, whether they get it or not, Dr. Nitin, no. That's where ophthalmologists have to put pressure on the optometrists and the opticians to make sure. Yes, it's a little bit more expensive, but is it worth losing the eye? And these are all real stories of broken spectacles which cause damage to the eyes itself. So coming to the title of the talk, Chandrayaan, Mangalyaan, and Drishtiyaan. If India can be launching all these satellites into parts of the world we can barely see with our eyes, Chandrayaan, for example, you should be very proud to say that, yes, this is where we are headed. We were the first country to land something on the south pole of the moon. No other country in the world is going to. You should give yourself your cap, being born in such a country. And that happens because of leaders like him who actually have paved the pathway. This is a mission which is going on since 2018, and Chandrayaan-3 just happened as well. And Mangalyaan as well, launching a probe to Mars, which I think now we lost track. At 5 to 10% of the cost, I think NASA has spent on it. This is Mr. Mailsamy. He was giving a keynote oration in the same conference I was there, but an ENT head and neck conference. I do a lot of multi-specialty work. Mangalyaan also showcased the fact that women in our profession can lead the way. And sadly, these are the women who are also victims of violence and trauma. Again, we people have to wake up. We have to bring up our children better and get the message across as well. That's where Drishtiyaan comes in. So when you can do all that, yes, we've had leaders in our own field giving vision to a lot of people as well. These are just showcase small examples. Around the country, work that's happening in the north, south, east, west, selfless work, so on and so forth. And that's Dr. Padmashri Sai Baba Gaud, who runs a school for the blind. He's an ophthalmologist, by the way. He can easily make a lot of money treating cataract glaucoma, but he runs an institution only for the visually blind, puts them through school education, college education, puts them in the workforce. Now the people in the workforce that he's treated for about 30, 40 years are coming back and thanking him because even when they were blind, ophthalmologists never gave up on these patients. So these are the Drishtiyaan leaders that we have in our profession itself. India is a huge country. We are economically great. Everybody is looking up to us because of that economic brightness as well. We lead companies around the world. They're looking to us for leadership, for dynamism, for crisis management, so on and so forth. And we have a rich culture. And the rich culture is all about women again. Bharat Mata, the mother. All religions also give power to women, actually. Our own president is a woman, right? This is where I think women should be empowered. You're no less. I have 2 daughters and a son. At the dinner table, and usually I'm keeping my mouth sealed because I'm outnumbered. But a mother is the best crisis manager. Manages the man of the house, the children of the house, fever, should I go to school or not? Should I take care of, should I take leave to take care of a child? They make decisions almost every single day. And we have several accomplished women in society. So where did we go wrong? I don't know. You should look inside and act as well. So we have to now empower these women. We should not be protecting them. When I bring this up to my own children, they said, I don't need protection. Give me what I deserve and I due. And that's all is necessary for our patients, women as well. Swami Vivekananda said this, 1863, right? He was born? 1863. Women should be put in positions of power to solve their own problems their own way. Gone are the days when we find solutions for them. And our downfall was largely due to the negligence of women. Likewise, Father of the Nation said this, a day a woman can walk freely on the roads at night, that day we can say we can achieve independence. So you can look at whether we have really achieved independence or not by these leaders who left these powerful words behind. So let's go back to trauma again. So those are messages again for the youngsters, for the future. Prevention, prevention, good management, think quality, and get it done right the first time. No half-hearted job. This is both for the patients and the surgeons who are managing these injuries. When there are regulations in place, follow the rules, discipline. Don't be a show-off and say, I don't need to do all these things as well. Sports players, when they all do that, why do they do that? Because it's a career at line. Simple. They lose a crores contract if they have an injury and they go blind. That's why they do it. So why do we take chances? We should not be taking chances as well. A lot more can be done by ophthalmologists, by policymakers, parents, children, and adults. Follow the rules and employment as well. Employers have a role to play, and that's where Indian Express, a paper I used to read, I still used to buy the books that they compile Indian history, so on and so forth, comes in. Rather than talking about Bollywood stories and Hollywood stories, yes, you can still do that. You have to sell your newspapers and magazine. Creating awareness, educating the public, showcasing bad stories, doctors there, so that you can showcase one case and said every single case you highlight, you can prevent 100 the cause of blindness. That's where we need to come in as well. So we are looking towards other industries for champions. In the showbiz industry, in the IT industry, sports industry, technology entrepreneur industry, so that you can actually take our message to the public, because they're more likely to watch you and listen to you than a doctor who sits in a little small cubicle in a clinic, so on and so forth. So finally, I would suggest say that eye injuries, 90% of them are preventable. And these are needless preventable blindness. When necessary, wear protective eyewear. So who really needs protective eyewear? All one-eyed patients. I still see one-eyed children, one-eyed adults walking around without glasses. They have only one good eye. The chance of that being injured is statistically much higher. Patients with poor eye conditions as well, pre-existing diseases, previous surgery should wear eye protection. Who are involved in high-risk activities, that includes sports as well. And bottom line, all children who require spectacles should wear polycarbonate spectacle lenses rather than standard cheap plastic lenses, which themselves can injure the eye itself. When a repair is done, motivation for us ophthalmologists is get it right the first time, rehabilitate, and never give up. With that, I thank you very much, everybody.
Thank you, Ganga. Can we have the chief guest and guest of honor on the stage, and request Smith to come and have the questions, and any questions from you people and all the students. Dr. Come, sir. Smith will moderate. And you're ready with the next part, no? Because we are already 5-10 minutes exceeded, but still I think we have to conclude shortly.
Thank you, sir, for your informative session. From the audience, if anyone wants to ask any question, Dr. Smith is here to answer you all. So, yeah.
So actually, it was an eye-opening presentation, let's say. And even after working as an ophthalmologist for this many years, we still get the goosebumps when we see these trauma patients. I still remember very first night when we were doing post-graduation in our residency, and Diwali night, we don't get the holidays. So I asked my seniors why. So they said that wait till the evening. So in Diwali night, the entire country is enjoying, only the ophthalmologists are on duty, especially in the government medical college, because our duty starts from 7 o'clock in the evening. It goes till morning 8 o'clock, because we see the people lined up with the firecracker injuries in our departments. So most of the people are enjoying Diwali, and the ophthalmologists are there to do their duties. So it's really bad. And from that first Diwali emergency duty, I decided that I will never touch a firecracker in my life again, or I will never allow anybody in my family to touch a firecracker. So it's a very important aspect for us to take away from here. You are the one that you can, create awareness. You are still young. I understand that you have that passion and that adrenaline in your heart running in your body to, have these firecracker fun things, but it's really bad when it happens to us. If you have any questions, if you have any doubts, if you have any, let's say, something that you want to ask our senior doctors are there, all our.
Maybe one question from the students. Yeah?
Yes.
It's okay. My voice is all I can. It's good that from layman's perspective I'm asking. Your session is absolutely good. I really liked it. You talked a lot about the preventive side. But somebody who is like me, with God's blessings, I have a reasonably good eyesight. Is there something which you would like to suggest that in order to maintain it till my whatever age, is there any prescription in terms of food habits or healthy habits one should maintain? Would you like to throw some light on that?
Have Dr. Nitin answer that
Well,
question.
the habits which you mentioned, I think, are the most important things. Avoid all the bad habits. Instead of telling you what good habits to follow, the main important thing is to avoid things like smoking, avoid alcohol in excess. See that your diet is well maintained. See that you don't, especially for the newer generation, because you have a long way to go. Don't fall into the Western trap of junk food. See to it that you have a lot of proper home-cooked food, which includes the greens, the raw salads, the fresh fruits, which I feel that nowadays younger generation is aping the West. So they would probably just settle on a meal of a burger and a Coke or something of that sort. Again, all these soft drinks and aerated drinks which have got a high amount of sugar in it, basically it's nothing but sugar solution. Again, aping it from the West, trying to have a Coke or a Pepsi with every meal. Nothing against the brands, but basically that is something which is turning India into a diabetic capital of the world. So more than the good habits, the bad habits should be avoided. Again, the younger generation is working a lot on the computers, on the screens, so maintaining a proper distance from the screen to see to it that every few minutes of working on the screen, they keep changing the focus from the screen, blink often, see that the AC draft doesn't come onto your eye. So all these things do help. And again, stop using excessive use of all handheld devices. I know it's difficult to say that, but things like mobiles, iPads, tabs, try and prevent usage of it, especially for entertainment purposes. Do things which you can do at a distance, like using a laptop or using a desktop or using the television screen, but try not using too much of handheld devices.
I would like to ask, how much do hereditary issues or family history contribute to a person's eye conditions maybe?
Dr. Natarajan is involved in the Global Eye Genetics Consortium. He does 100 things. He's like the typical Lord Nataraja, stands on only one toe and one foot, but he's in the cosmos everywhere. Would you like to answer that question?
So we have a Global Eye Genetic Consortium. There's a eye doctor called Arnold Sorsby, wrote a book in 1946. He said, eye is a playground for genetics. So most of the genetic problem will have eye connection, something in the optic nerve, retina. And then we have the thing called inherited retinal degeneration, called IRD. And unfortunately, India has about 10 million people with that problem, where they don't go totally blind, but they are born with some vision, and the vision keeps going down. So that's why I'm working on artificial retina, gene therapy, then robotic retina, and as sir said, even the regenerative medicine like retinal stem cell. Stem cell is working in the front of the eye, but the retina doesn't work. So we are struggling, and last 40 years, whole world is doing research. We are in the last in India. I'm glad to know about the two Indian Institute of Science students working with them. So one day I have to go to sir, and no, really, we have to make pitching for funding, because we want young people from the medical science, not medical, the life sciences to come and work with us to prevent, because we have the highest number of preventable blind and inheritable blindness in the world, and we should not be proud of that, but at least we should do basic science research, which we are doing the least, and the US and Europe is doing the most. And diabetes is unfortunately also, because of stress induced in India, bad diet, sedentary life, and genetics also. So the problem is diabetes, we don't know who will go blind, who will have a leg removed, who will have a the stroke, a heart attack, death, then renal failure and death. So that's why every patient I want to do HbA1c from the age of 35, do every year, so that you lead a healthy life, as Dr. Nitin said, and Ravi Shankar asked, eat healthy food, low fat and high protein, low carb, and also eat green leafy vegetables as much as you can. So you can fill your stomach with more leafy vegetable. Eat non-veg, eat whatever you want, but that should be the least for your taste. And anything fried is not good, both for age-related macular degeneration, for diabetic retinopathy. And everybody thought our Rakesh Jhunjhunwala died of heart attack or a cardiac arrest, but he died of diabetes. And we have a diabetology who says diabetes is die in bits. Why should you die? If you control, I think you can prevent a lot of complications. And inherited, you don't, India was doing consanguineous marriage, that marrying your sister, son, or a brother, whatever the close relation. India had the highest. That's why even the eye cancer, retinoblastoma is high in the world in India because of genetics. Apart from, he said 1 out of 14,000. Genetics is a problem. We can do genetic study. We can predict who will get and who will not get. But again, you need money. No patient wants to pay for genetics. And my father started the first genetic eye clinic in 1984 in government eye hospital in Madras. But still, we are primitive. A lot of people don't want to do study. And another big industrialist son who had a genetic disorder, he went and got it diagnosed in UK, but he wanted vision somehow. But you can't get what you want. But you have to find a way to accept the truth. That's why me and Dr. Gangadhar is counseling a 7-year-old boy's parents and grandparents how to take the reality. We have done the best in the world, but you cannot get a new eye. They all, like a movie, I always tell, we can't do, sir, all respect to Bollywood, they want operation next day to see. But cataract can be done, but not the injuries and retinal degeneration or retinal problems. So prevention is one thing, and don't marry in your own relative. The mix is very good. And then genetically you can dilute that so that the next generation will. Every patient comes to me and tells, sir, my father, mother are all right. But nobody knows their grandparents, maternal and paternal, and their great-grandparents. They are a thing called carriers. They carry the gene, why I am dark and why you are fair. A gene is responsible. Why somebody is tall, why some. It's not a disease, but it's a gene problem. So that's why we are now, like the computer, we are doing gene editing, gene cutting, and then gene pasting also.
Great explanation. Any further questions? Then
I think we are coming to an end. Maybe Nitin can conclude.
Yes.
Dr. Navneet,
I'll
you want to
request Dr.
say
Nitin,
something
sir.
for the legal things which we are doing for eye injuries? Dr. Navneet Wadhwa is a medical writer, and we can take help of our the internet. He's got a mic.
Thank you, sir. Thank you, Dr. Gangadhara, and everyone else for the powerful deliberations. I think safety should be a prime concern in our country. We are inherently not accustomed to that. I think sir is working aggressively towards filing a PL that the type of firecrackers, what they cause the damage at the sake of fun, I think that has to be curtailed. So that's one. Another move which is coming up, safety should be inbuilt in our mind. That's the message.
Thank you, Navneet. So Dr. Nitin to give his conclusion.
Dr. Gangadhar, that was one of the probably the best lectures which I've heard in a very, very long time. And even having worked in this field, I feel that there were so many things to learn, and I think there were so many take-home points. You asked one question is, where did we go wrong? I feel we all went wrong only in one thing, in not teaching our male childs of their limits and their boundaries. We always talk about telling the daughters not to do this, not to do that. But I think the primary mistake in the Indian society is that we've not educated our male childs about what they should do and what is their limit. I think that is very, very important, and that would prevent quite a few things, including things like domestic violence, violence against ladies throwing acids on the people because somebody has said no to you. So all these things I think comes from a proper education. And as young children, as young adults who are there in the audience, I feel that everyone should see to it that they follow these, their limits. Regulations for various safety norms, I think that is very, very important. There are quite a few industries in India, like the welding industry, the gas cutting industry, where people are forced to work. Not that there are no regulations, there may be regulations, but the employers in the small scale industries would not give them the protective glasses. And we see so many of these welding accidents which occur on a day in and day out basis. You mentioned about the people losing jobs if the firecracker industry is regulated and you have the fire shows in a stadium.
Yeah.
But then my answer to that would be, would you say that people who are manufacturing illicit liquor, hooch, that shouldn't be banned because their industry would be lost? No, I think it is very important that the regulations come in these things. Dr. Natarajan has been trying to get his PIL ahead, and I think that would be a right path ahead. The bystander effect which you mentioned about, I think in today's era, all young people, especially who are on social media like Instagram and things of that sort, should realize where is the limit. So if you see something happening, it is not important to make that video and post it so that you are the first to reach the audience, but to try and help out the people instead of having these great likes and what all you get from your Instagram posts. Regarding the regulations, I feel that it's also important, along with the regulation in the sport industry, in the sports, it's also important to realize not to glorify certain things. If people who saw the Olympics recently would have seen a shooter who came from, I think, Turkey, who came in without any eye protection, and there were so many posts after that, so many articles after that, that he could do it without any eye protection. I don't think we should glorify that. The entire shooting council has given certain norms because these are safety norms. Just because one person comes and does it depending on his whims, I don't think we should glorify that. A small thing for even the serials and all, we saw a lot of eye injuries which occurred after a famous serial like Ramayan came in, because people were all playing, young children were playing with bows and arrows. I feel if our advertisements can mention that these stunts are done by trained professionals, I feel each and every one of our serials which have such dangerous sport being shown should have a line, like they have that moment you see shows someone smoking in a serial, there's a tagline which comes that consumption of tobacco is not good for health, is injurious to health. So similarly, if there is some bow and arrow shooting taking place, people should think about putting in the tagline that this is a stunt which is not to be done by lay people and it can be harmful to you. Thanks a lot. These are a few of my points which I have.
Thank you, sir. I further request Jyoti to please deliver the vote of thanks for all those who have come here. Jyoti, please.
Good evening, everyone. My name is Jyoti Gupta. I'm Clinical Research Coordinator of Adityajyot Eye Hospital. I'd like to our heartfelt thanks to go to our chief guest, Shivaji Satam sir, for gracing us with your presence and sharing your valuable insights. We are also deeply grateful to our guest of honors, Dr. Nitin Balakrishnan sir and Mr. Harish Mehta. Your support and participation have been greatly appreciated. Our appreciation extends to the oration of Dr. Gangadhara Sundar sir for their significant role in today's program. Your contribution has been truly inspiring. A special thank you to Dr. Navneet Vadva sir, our special guest, for your distinguished presence and enriching our event with your wisdom. A thanks goes to the KSF team and Leo Club of GN Khalsa College. Your hard work and dedication behind the scenes have ensured the seamless execution of this event. Your efforts have not gone unnoticed. We are also grateful to our sponsors whose generous support has made this event possible. Your commitment to our cause is deeply appreciated. In closing, I would like to thank each and every one of you for your presence and active participation. Your engagement has been the cornerstone of today's success. I would like to apologize if I have missed anyone, and thank you from my side. Thank you. Thank you so much.
Thank you, Jyoti. I thank everyone who was present here for this lovely evening. Thank you, Dr. Gangadharan, Shivaji sir, Dr. Nitin, Dr. Natarajan sir, and Mr. Harish. Thank you so much. All this information were very informative. I would like to wrap this session now, since with respect to the due timing of all our chief guests and guest of honor, we'll just stand up for the national anthem and wrap up this session, please.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविण उत्कल बंग विंध्य हिमाचल यमुना गंगा उच्चल जलसि तरंग तव शुभ नामे जागे तव शुभ आशीष मागे गाए तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे थैंक यू
Sir, so sorry, I went a little bit overboard, maybe stay much longer. लवकर लवकर घ्या